Welcome to this 30-minute lecture on respiratory infectious disease prevention and preparedness. I'm Michelle Quinn, Emergency Preparedness Coordinator for the Elliott Bay Ward in the Seattle North Stake. I also work at Harborview Medical Center as a certified audiologist. There's an emphasis on this lecture for the coronavirus disease 2019 or COVID-19. This is a respiratory illness. Transmission is mainly through respiratory droplets and close contact, similar to how influenza or the flu is spread. Let's take a look at the difference between droplet transmission and airborne transmission of disease. Droplet transmission, the disease is inside respiratory droplets generated from coughing, sneezing, or talking. This is where the 6-foot example comes from as a recommendation from the CDC to prevent infection and illness. Examples of diseases that are spread through droplet are pneumonia, influenza or flu, COVID-19, and whooping cough. In contrast, airborne diseases float through the air and are everywhere. Examples include tuberculosis, measles, and chickenpox. These tend to be much more serious disease to contain and stop from spreading. Because COVID-19 is new, we are still learning about it. Patients are being treated with the higher level of personal protective standard, like what you would see with airborne transmission. For example, the use of hospital isolation rooms. Here is a picture of somebody wearing a PARS hood respirator, and of course you've heard of the 95N masks, etc. Coronavirus disease symptoms can be mild to severe and involve respiratory illness. The three main features as defined by the CDC are fever, cough, and shortness of breath. The primary complication to coronavirus is pneumonia. This can lead to the hospitalization of patients and to the fatality rate of COVID-19. It's important to know that COVID-19 works more like a flu than a cold. Here we have common symptoms and the similarities and differences between the two. It's important to realize that symptoms of a cold usually have gradual onset, whereas influenza can be a very fast or abrupt onset. Fever is rare in a cold, but common in influenza. Headache is also rare in a cold, but common in influenza. As we compare this to COVID-19, fever is very common, just like the flu. Cough is common, which can be seen across all three diseases. And then shortness of breath is not common to influenza or the cold. We'll come back to these symptoms later when we talk about seeking medical management. Coronavirus is thought to have an incubation period of 2 to 14 days with an average incubation period of 4 days. Patients are thought to be most contagious when they are symptomatic. This is the worldwide outbreak map provided by the World Health Organization as of yesterday, according to the time of this recording. This is the CDC outbreak map for the United States for yesterday as of the time of this recording. You can see that the primary states of concern are California and Washington. COVID-19 is not the first coronavirus. If we look back, 2002 and 2003 had SARS outbreak, 2012 had MERS outbreak, and then I've put the statistics on here for COVID-19, both within the province of Hubei, China, which is the original start, and then outside of the province of Hubei, China. You'll notice there's quite a big difference in the fatality rate between the two. For comparison, I've put influenza on here, even though it's not a coronavirus. You can see a commonality in the percentage of fatality rates across SARS, COVID-19 within Hubei, China, and influenza. With the COVID-19 virus, age makes a big difference to fatality rate. This comes from the Chinese Center of Disease Control looking at approximately 44,000 cases. It was determined that 80 years and older is the difference for raising the risk for fatality rates, which can be seen here as 14.8%. Also of note, according to this study, there were no deaths in children from 0 to 9 years old. This is a significant difference to influenza. Influenza or the flu, the upper age range is marked as 65 years and older for increased risk, as well as for children, especially under the age of 2. Most COVID-19 infections have a mild set of symptoms if you're ages 30 through 79, and most is defined as 86%. This comes from the same study from the Chinese Center of Disease Control. Let's take a closer look at some of the statistics around influenza versus COVID-19. Last year, the 2018-2019 flu season, in the USA alone, there were approximately 35 million cases of people with flu-like symptoms. 34,000 resulted in deaths from flu. To compare that to the current outbreak of COVID-19, as of today, worldwide, there are 95,000 confirmed cases and 80,000 of these are in China. There's been just over 3,000 deaths from this virus. For the United States total, there's approximately 100 confirmed cases and 10 deaths. Note that there are no details concerning these deaths in terms of age of the patient or other illnesses that they may have had. One of the primary concerns is that while there are only 100 confirmed cases, there are most likely many more that are infected but not yet showing symptoms, hence the concern for an outbreak. Also, a major concern is currently there is no vaccine and no specific antiviral treatment for COVID-19. This is as opposed to the flu, which does have a vaccine, and influenza can be prevented for most people through a flu shot. Okay, let's switch gears to what you can do to stay healthy and avoid sickness. The best things you can do to protect yourself are within your power. First and foremost, I cannot say this enough, but wash your hands with soap and water. You may have seen this graphic go around your social media. The top 3 hands are without soap. The bottom 3 hands are washing with soap and water after 6, 15, and 30 seconds of scrubbing. The CDC currently recommends 20 seconds scrubbing your hands with soap and water. Examples of when to wash your hands often: before eating, before cooking, when coming home, after using the bathroom, after touching public handrails, doorknobs, etc. There is a right and a wrong way to wash your hands. This comes from the University of Washington Medical Center, which did a piece with our local Como News outlining protocol for correct hand washing, including get your hands wet first, do not put soap onto dry hands, apply soap, and any soap will work. It doesn't necessarily have to be antimicrobial or antibacterial. Scrub for 20 seconds. Watch that you get the back of your hands between your fingers, your fingertips, and your thumbs, which are places that are commonly missed when hand washing. Lastly, do not touch the dirty faucet with your clean hands. If you're able to, use the back of your wrist or your elbow to turn off the faucet at home. If you're in a public restroom that has disposable paper towels, grab a towel and turn off the faucet. Throw that towel away and then get another towel to dry your hands. Avoid touching your eyes, nose, and mouth with unwashed hands. Again, this has to do with the droplet transmission of this disease. Cover your coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze. Throw that tissue into a lined trash can and either wash your hands or use hand sanitizer. Again, the idea is to have a barrier between those droplets and your hands, and then to make sure there are not any droplets left on your hands. If you have worked with kids or in a daycare, you will know this protocol well. You do not always have a tissue available when you cough or sneeze. And so instead of coughing into the air or into your hands, which are going to touch other objects, cough into your elbow. This is what it's going to look like for adults. This is commonly taught as part of a hospital practice. If you're not able to wash your hands, use an alcohol-based hand sanitizer that contains at least 60% of alcohol. Purell is the most common example. This picture I took from my office at work. I suggest that you put hand sanitizer next to your tissue box. After you use a tissue, hand gel. Avoiding hand shakes, again, trying to diminish the amount of droplets that are transferring from one person's hands to another. Suggested alternatives include fist pump, air high five, and of course the use of Purell hand sanitizer. Clean and disinfect frequently touched objects and surfaces. This can include, but is not limited to, countertops, tabletops, doorknobs, bathroom fixtures, toilets, phones. Just think of everywhere that your smartphone or iPhone has been. Keyboards, tablets, and bedside tables. Also, clean any surfaces that may have body fluids on them. I personally like to use Clorox disinfectant wipes at home. Any cleaner will do. Lysol is very common. At the hospital, we use the Super Sani cloths or Super Sani wipes. These do require the use of gloves if you're going to use them. Use your cleaner according to the label or instructions on the back. The main thing you can do to avoid getting sick is to avoid close contact with people who are sick. This is a major point and very important. This is where we get the recommendation this week from King County in trying to protect our community from this disease. Specifically, I'd like to highlight that they have a section regarding community gathering considerations. This says if you can feasibly avoid bringing large groups of people together, consider postponing events and gatherings. This is one of the reasons that our church worship services have been put on hold until further notice. The recommendation, if you can't avoid being in a group or together with other people, urge anyone who is sick not to attend. Encourage those who are at higher risk to not attend. Try to find ways to give more physical space between people. Encourage attendees to maintain good healthy habits such as hand washing or hand gelling. And then clean surfaces with standard cleaners. Be a hero. If you are sick, stay home. As stated before, for most of us, if a COVID-19 infection is experienced, it's going to be mild symptoms that feel like a cold or flu. The best treatment is to get lots of rest and drink lots of fluids. Even if you are not sick, one of the number one things you can do for your immunity is to get lots of sleep. More information about this can be found on the Sleep Foundation website on how sleep affects your immunity. This is also very important. If you are feeling the need for medical attention, call in before going in for medical care. Part of this is if you do need to have medical care, they can prepare for you coming in as to reduce your likelihood of infecting other people as you come into the medical center. Seek medical care for symptoms that are worsening, especially shortness of breath or difficulty breathing. And for adults, if your temperature is 103 or higher. When to use a face mask. Face masks are currently not recommended for the general public. Again, this is because this disease is droplet transmission, not airborne transmission. They're only recommended if you have a cough that you could transmit, so you're trying to keep those droplets from spreading, or if you're taking care of someone who is sick with COVID-19. And again, that goes back to that extra level of precaution where many of these folks that are sick are being treated like they have an airborne illness, even though this is a droplet transmitted disease. A note on masks. These kind of flimsy face masks are generic. They are designed if you are the person who is sick to keep droplets from coughs and sneezes from spreading. On the flip side, these masks are the 95N masks that are recommended if you're taking care of somebody that has COVID-19. These are different. They are pre-formed with a tight seal around the nose and face, and they have a built-in filter. Emergency preparedness for illness. Those who are at extra risk, if you have an existing medical condition, especially respiratory or breathing difficulties, such as asthma or COPD, if you are immunocompromised or have chronic lung, heart, or kidney conditions, make sure your prescription medications are not expired, such as inhalers, and are not running low. Emergency preparedness for illness, helpful items to have in your home. Over-the-counter medications to treat symptoms such as fever, cough, and other cold-like symptoms. Vitamin C, D, and zinc for supporting immunity. 2 weeks worth of food at home in case of quarantine. Soap, hand sanitizer, cleaning supplies, and gloves. Finally, tissues, a thermometer, and in some cases a mask. Lastly, preventative medicine, keeping a healthy immune system, keep a healthy lifestyle. This includes getting adequate sleep, moderate daily exercise, eating healthy, more fruits and veg, less processed foods, minimizing stress, and avoiding getting the flu by getting a flu shot. In summary, preventing droplet spread of disease includes washing your hands with soap and water for at least 20 seconds. Do not touch your eyes, nose, or mouth. Cover coughs and sneezes. If at all possible, stay away from people who are sick. Stay at home if you are sick. Clean and disinfect objects and surfaces. Regular household cleaners are sufficient. Call in before going in for medical attention. Boost your immunity, including getting lots of rest. That is the end of this presentation. Thank you for digitally meeting with me for this update on COVID-19 and how you can protect yourself from sickness and be prepared for the future outbreak of this disease in our community. If you have any questions, please feel free to contact me directly. My email is mquinnaud@gmail.com. Thank you very much.